Welcome back to Conscious Caregiving with L&L. I am your co-host, Lance A. Slatton, also the host of All Home Care Matters. And as always, I'm joined by my esteemed colleague and friend, Lori LeBay. Welcome, Lori.
Well, hello, Lance. I am thrilled to be here today, and I can't wait to talk to our guest, Dr. Shawn Weiss. She's always just filled with so much great information and coming from the holistic view. Boy, I think that is really needed in today's healthcare. So,
Yes, absolutely. And of course, Lori is the host of Alzheimer's Speaks, as well as the co-founder of Dementia Map and the author of Betty the Bald Chicken. And the list keeps growing, Lori. Congratulations. But yeah, you mentioned our guest today on Conscious Caregiving with L&L is Dr. Shawn Weiss, who is a powerhouse speaker, a renowned doctor of physical therapy, and a health strategist with over 27 years of clinical mastery across the healthcare spectrum. Welcome, Dr. Weiss. How are you today?
I'm doing great. Thank you for that really lovely introduction. Wow, I feel really special. Thanks. I'm excited to be with you guys today, and it's nice to see you again, Lori. So, yeah, this is going to be a lot of great information. It's going to be a lot of fun.
Yes, it is. And thanks for being here. Is it okay if I call you Shawn or do you prefer Dr. Weiss?
Oh gosh, I only make my husband call me Dr. Weiss, so Sean's fine.
Nice. Okay. I want to kind of start off, a lot of seniors can feel like their best years are behind them, right? And I know I was talking to a friend of mine the other day who is only in his 40s and said, the best part of my life is over. And I'm like, what are you talking about? It's not even half over. But what are your thoughts on this since you've worked with seniors and been in the healthcare industry for so many years?
Well, you know, being in the industry for over 27 years, 20 of which spent, as an agency owner, I just seem to, and I think it's getting worse, but I do think adults, especially over 60, I'm 55, and there's days where I'm like, wow, you're starting to add it up, do the math, but I don't get into that mindset. But so many people seem to be internalizing that concept that this is this is all there is, right? That their best years are behind them, and there's nothing more that they can learn. There's nothing new that they can do, and they really get stuck into what I call that a fixed mindset. And when that happens, it really creates, I think, a spiral effect on their overall health, because then you don't really have a sense of purpose.
Mhm.
And so many of our seniors, especially those that are in senior communities, I'm seeing that more and more, and not just with the clients or the residents of those communities, but with their families and their caregivers. They just kind of feel overwhelmed, and um, again, just such a fixed mindset. So I'm all about changing that and fostering growth, and changing people's way of thinking when it comes to aging gracefully and aging with being able to thrive. But yeah, people seem to just, my parents included, they're just kind of like, yeah, well, this is just how it is. I'm getting older. I expect to not be able to move as well, and can't really go places, and I can't breathe, and they just kind of, sometimes they don't even realize they're doing it, but they feel like this is all there is.
Let me ask you before we go to the next question, where does that mindset originate from? Are they getting that just because that's kind of how society has, perceived them and perceived aging, or is that coming also from their healthcare providers?
Well, if you look at that, that generation of those probably 65 to 85, that generation, really is grounded, I think, in the concept of um, very much into, you know, I don't want to say like doctors are gods, but
Right.
they trust their healthcare providers. They, you know, hang on their every word. They don't ask questions. They're not intuitive. They're not skeptical, and they just kind of take things for what they are. Give me the 5 pills and I'll just deal with it, right? I think that is. I think it's a generational thing. I mean, if you take a lot of um, people in their 30s and 40s, their mindset on health right now is more holistic. They're more open to understanding the intricacies with all of the systems of the body, and what you need to do to prepare yourself for your future, right? But I have patients now that they just feel like they're kind of stuck, and how am I going to get them to change their belief system And that starts with, it's not all about the exercise, right? As a physical therapist, yeah, I want people to move, but it's not all about that.
Right.
It really starts right here.
Yeah.
And some of that might be environmental, social
Yeah.
too.
Yeah. I know. I think especially for like our television and Hollywood industry, there's a excuse me, there's a lot of implied ageism. TV advertisers are targeting that demographic of the 16 to 25-year-olds or whatever it happens to be. Um, you know, with that mindset though, what are our elders today in society, our seniors, what are they really concerned about? Like, what are you hearing is their number one concern?
Well, most of my career is spent probably at least half of the time in senior communities. And that, the assisted livings, they're going up. I can't keep track of the senior communities that are going up, but I think there's a difference between those who are still in the community, maybe still in their own homes, and the mindset of those who have maybe moved to an independent senior community or an assisted living community. And I feel like their biggest concerns are that, um, I hear a lot of family dynamic concerns. I have family dynamics with those who are still living at home, whether or not mom or dad can stay there. And, the rise in cognitive impairment with the senior communities is certainly coming into play as well, where families are kind of lost. They don't know where to turn. They kind of give up. They don't have the resources to keep mom, dad, or grandpa home. And they really feel like they need to reach out to these communities where they're worried about the quality of care that they're receiving. And the residents themselves are worried about the quality of care that they're receiving. And I think that just goes to speak, since COVID, I swear, I really think that there's a lot of understaffing in some of these communities. And it's not that that's necessarily their fault or that sometimes their hands aren't tied with that, but there's a lot of push to, utilize home health, making sure that they have the resources in place for those who are starting to decline cognitively, and really providing a framework for the families and how to navigate what's going to happen 1 year from now, 3 years from now, 5 years from now. People kind of flying by the seat of their pants, I think. I don't know if, Laura, you might have seen that too, but it's definitely different since COVID, I believe. And I don't see that a lot of things have improved since then. I don't know if you've seen that as well.
Yeah, I know we have a home care company, Shawn, and one of the biggest two things that really for us came from COVID was people discovered that there are other long-term care options other than going into a nursing home, which has been wonderful for a lot of families. But B, that same side of the coin is there's staffing shortages across the board everywhere. And it's not just, I feel like, in the healthcare industry as a whole. I think it's just in the employment industry as a whole. I can give you examples, one of our local banks, they've reduced lobby hours if they have them at all, or it's just drive-through only, or, restaurants that eliminate dinner hours. And, that's been one of the biggest consequences as far as employment has gone since COVID, I feel. And sadly, we aren't seeing much improvement since then either. I don't know what the answer is to
I
that.
agree. When you're 5 years out and
Yeah.
still seeing it, I still see businesses closed on Mondays.
Yeah. Yeah.
For that, especially restaurants, here locally closed on Mondays.
Right. Yeah, I want to kind of dig in a little bit more on, the aspects of concerns. Now, seniors have a set of concerns, but then do those differ a lot, or do you find that they differ a lot from like what the family concerns may be or the healthcare professionals' concerns?
Well, I think I see an overriding pattern, and I think it goes together, and a lot of the work I do, even if I'm seeing somebody for physical therapy alone, is I'm doing a lot of that holistic care because caregivers are burnt out. They're overwhelmed. It doesn't matter if I'm talking to a daughter, a son, a niece, a granddaughter. They are overwhelmed. They're stressed. Their health and their personal health is in decline. So you look at that, you really can't look at that as a separate thing. So when I do caregiving training, because what's going to happen if whether you're a professional caregiver or maybe a family caregiver, what happens when your emotional and physical health is in decline? You don't know where to turn or how to find resources, and you feel guilty and you are frustrated. That is going to carry over to the person or loved one that that energy transfers, that cycle of negativity and decreased hope and decreased joy, and that's going to transfer to the person that you're taking care of. So I see a combination where if I see a really great family dynamic and the support system's there and they have a more holistic view, maybe their nutrition is great and they're sleeping great, there's definitely a difference in those community, that community or that family versus say somebody that does not have that, or they have a daughter that is the sole caregiver and she is worn out.
Right.
And I see that translate into the frustrations of my patients because they see it, they feel it. And that's a source of stress for them as well.
Yeah.
So it's really about providing the options and the education for both.
Right. And I feel like that dynamic of the family caregiver is so crucial to the long-term care of their loved one. And what I mean by that is, we'll see, an 80-something-year-old woman with, hip displacement or, whatever the issue is that she's dealing with. She's mourning her abilities and lack thereof, but then now you add on top of that, she's seeing what it's doing to her daughter who is sleep deprived, having to miss work. So she's kind of dealing with a double-edged sword there. Do you have any recommendations from that standpoint for families?
Well, I'm always about first, taking care of, the caregiver and giving them resources and training in mindset. And the 7P roadmap that I swear I use pieces of that every single day. It's something I use in my life, but it just carries over to everybody, my patients, their families. They are looking at, okay, how do find a tribe of people? There are people out there. What are the resources, whether it's friends, family, neighbors, community? How do you find people to bring into the circle that can assist in taking some of the slack, even to give you time to do some self-care? That's a huge one, is they just feel like they don't know where the resources are, or they feel guilty, or I'm not good enough. If, I can take care of it. I want to take care of it. And I can tell you there's a lot of I'm one of them, a lot of only children who are in that situation where they're still working. They're trying to navigate getting to mom and dad. My parents are an hour away. And that seems like that's a pretty easy jaunt, but it's not when, at one time I had both of my parents having cancer and I was going back and forth. And it's almost like your head's in it so much, you forget to look up. And when you don't look up, you don't see what's around you. You're not in the present, and learning to be present and looking out to find what you can bring in is super critical.
Yeah. And I know for myself as a family caregiver, I know Lori was, a lot of times it's easy to say it, but it's harder to do it. Right. And, sometimes we have to just find that on our own. Hopefully that's why we do shows like Conscious Caregiving, and the work that you're doing is so that people can find this information so that they can be supported. I wanted to talk a little bit about, your own perspective. Has your opinion of what's possible for people as they age changed as you saw, with your family, friends, and even yourself aging?
Well, I think, I've been really afforded a unique opportunity over the 20-year period that I owned a home health agency and was a clinician. So I got to see both sides of the coin. And now, fast forward, heck, my kids were 5 and 2 when I started the company, and now they're 26 and 23. And I'm exited out of the corporate space. So yeah, I've experienced transitions of my own, even with health. I've had my total knee replacement. I'm going, I've already, going through the menopause situations and being a caregiver of my parents. So you get that, don't ever discount going through that at the same time. But I'm more hope. What brings me hope is when I exited the corporate world and founded Rockstar Health, Rockstar Seniors, it really was to bridge that gap. And because there is a gap, and I wanted to bridge that and fill it in from a conventional medicine approach, which was, I'm trained in, I've been practicing for 27 years. There's certainly a place for that, but really interjecting that holistic approach to where, understanding the interconnection between how you're sleeping and your health, the stress levels and your health, your nutrition, and whether or not you're going to recover from a surgery. Really putting all those pieces together to where I, incorporate that with every single patient. So that's really kind of brought new life into me, that I'm able to bridge that gap by combining the two. And I think there's a lot of call for that. People are wanting to know those strategies. And again, there's always a place for our conventional Western medicine approach. It's very compartmentalized though. You have all your specialists. When you have patients that, they're listing their 8 doctors, and that none of them talk to each other. I feel the responsibility in, to bridge that, to kind of connect them all, right? To say, okay, well, hold on a second. When was the last time you went here, and what did they do for you? When was the last time you went here? And I think you just get so used to being in that world that until somebody says, okay, hold on a second, let me talk to you about why having a good sleep routine is going to be so critical as you recover from your pneumonia, as you recover from your hip fracture and total hip replacement. Let me talk to you about that. And suddenly light bulbs are going off. And I always try to incorporate the family. If there's family that can come into those sessions with me, I'm always trying to include them as well. So I feel, to answer your question in a really long about tangent way, I feel really hopeful. In the way that I think there's a lot more practitioners that are going in that direction.
Yeah.
And I think it really does breathe new, hope and purpose into the older adults when they feel like, hey, okay, maybe I can do this. Maybe this is not all there is. I want to foster a growth mindset. And I think the way to do that is through a holistic approach.
No, absolutely. And I agree with you. I feel like it has gained a lot more traction than it had even 10 years ago.
Mm-hmm.
But my question would be, for somebody that's watching or listening to this, Shawn,
Mm-hmm.
a year from now, 2 years from now, or a day from now, and they're like starting to sense that this might be a good approach for their own health, where do they start at though? Do they go into their primary care and say, I want to start on a more holistic medical approach? Or, you know what I mean? Like, how do they take that first step?
Well, unfortunately, that probably won't get them very far. Although I did just read yesterday, and I totally forget. I mean, you just mentioned it, and I probably have to go back and look it up. One of the medical schools, it was a prominent medical school in the country, is now incorporating nutrition and sleep into their med school curriculum. So I think that just makes me really excited to hear that. If everybody could do that, I feel that what I do, and you really do have to go kind of outside, I think, your family practitioners, where you're probably not going to do that. There are some gerontologists that kind of have more holistic approaches, but you can find health strategists and health coaches that are clinicians, nurses, therapists. What I do with Rockstar seniors is, I do consulting and personal coaching. We are out there with rockstarseniors.net. You can see, it all starts with a personalized call. Like, I filter everything through that because I want to hear somebody's story. Because my approach for you might not be different. Maybe will be totally different than, say, my approach for Lori. I want to see what your needs are. I want to do that lifestyle screening. And that's kind of where you need to start, is getting on the phone with somebody that's actually going to take the time to listen to what you're struggling with. And maybe you're struggling yourself as a caregiver, and you're taking care of mom, and mom's struggling too. I like to fold that all in together into my coaching packages. So I do everything from consulting with senior communities to providing one-on-one, coaching through things like fall prevention, cognitive impairment, or just, like I said, my 6-week holistic 7P roadmap of like, let's just go through it all and just see, the magic that happens at the end of that 6 weeks. I think I'm seeing more and more people that are getting into that space.
That's wonderful. Before we go to Lori, I just want to ask you, you developed a strong body, sharp mind, bold spirit based on your years of experience in physical therapy with the majority or of your work in older adult care programs. How did that framework support our elders holistically to reclaim their health, especially when they feel overwhelmed and stuck in their current routines?
Well, the strong body, sharp mind concept really is an adjunct into my Look Up and Change Your Life 7P roadmap. I've integrated that in with especially emphasis on older adults, even those with cognitive impairment. And that is just, again, getting people to break that mindset. So I have a 7P roadmap. And what I do is I integrate the 6 pillars of health. And Lori, I think, has heard me talk about my 6 pillars of health, which are stress, sleep, nutrition, exercise, gut health, and emotional wellness, which is your mindset. And when you take those 6 pillars of health and you incorporate them into what I, discovered for myself, which was a 7P roadmap, and that's a funny story in and of itself of how I came about the 7Ps. It's like I realized my approach to everything I do, they all started with a P, and I'm like, oh my God, this could be something here. And it really is taking people one by one through these concepts. For instance, people. We talked about people a minute ago, and auditing the people in your life. And when you're an older adult or a caregiver of an older adult, you can, it goes for both of them. Like the caregiver, I'm going to look at who can I bring in to help you, right? Who can we bring in to facilitate you being able to take a break, you being able to get better sleep, you being able to go do some self-care, go get your nails done, like simple things like that. Whereas if you're talking about the actual older adult, when you're looking at, okay, how can we establish meaningful connections, right? That's the people concept for the older adult, is whether or not you're living at home alone and the daughter's coming in a few times a day, you spend a lot of time in isolation, you don't have a lot of socialization. But I also see that issue in people who are in assisted living. They've never been social in their whole life. You're not going to force people to go interact and do all the card clubs and the bingo and reminiscing groups and happy hours. You might not do that. So you need to find a way to facilitate community with the older adult, the connection that reduces isolation, which then just spirals health. Your health is going to go on decline if you are not socializing and interacting and preserving cognitive function. So, each of those concepts, people being one, being present, finding a sense of purpose, all of those will go in with those 6 pillars of health. So when I created, the strong body, sharp mind, bold spirit, it really was to say, hey, we're going to take you from this fixed mindset of thinking that you got nothing else going on the rest of your life, that you can't learn new skills, that you can't have a better quality of life. And I'm going to take you to a growth mindset, and we're going to start making little changes to where you will see how you physically and emotionally feel better. And the next thing you know, you have a sense of purpose and you want to try things and you want to get out there and work harder, even from a physical standpoint. I do that type of work when I just want to increase compliance.
Right.
When people don't want to do their exercise or they don't want to move their body, integrating those types of approaches does wonderful things for somebody's, sense of motivation that, hey, there is hope. I recently have a patient and she's young, she's 70, had some major health issues, has not walked in over a year.
Wow.
And when I walked into her home and saw that she lives in the hospital bed in the living room of a really small ranch, and she's brought in their grandson, her husband lives there, grandson and granddaughter now live there. And as I got to know her over the first few sessions, it became apparent to me that there's a lot more going on. Like she had kind of given up. She was in the workforce 2 years prior to that. And I kind of saw, okay, this is more about, a lot less about me coming in to fix your leg and a lot more about, hey, what is going on? And within 8 visits, she's now walking 20 feet into the kitchen and is helping with the laundry and things like that. So I've done a lot of mindset work with her, and we've talked about nutrition And we talked about energy and how you fuel your body to help your muscles function and getting more protein. And she's doing wonderful. And, in the beginning, somebody else might have, written her off. I mean, because her mindset was, she's like, well, yeah, I'm in the bed all day, every day. And it was very sad to see. And I just wasn't going to have it.
Right.
And she had a grandson that was I mean, he was so encouraging. And that is huge.
Absolutely.
So you have to, get people around there to have a vested interest in what you're doing. They got to buy into that,
Yeah.
right? That you have I just have a feeling. I've watched her move throughout this bed, and there's no reason that she can't be up moving. We're going to change this. So, that's an example of one of the stories of success that using this holistic approach.
So with your example, and we'll go to Lori, for your example though, Shawn, are you consulting with her physician, like her primary care or anybody?
Yeah. Well, she's one that I'm doing traditional home health with. So yes, my plan of care has some of that stuff built in. Is that something that Medicare is going to know? Medicare, I got to focus on what I'm sending there for, right? This particular patient is physician ordered skilled care. So we achieved the goals we need to achieve for that. But working on the other things, yeah, I put that in there, and I let the physician know in my summary notes that this is what we were working on. But guess what? We met the goals, so we checked the boxes. Yeah. So that you get paid, right?
Well,
yeah,
and that's good. But what I was really curious about though is, are you making them believers in your approach?
I think so. I was just on the phone with that particular client yesterday, and she's like, I've had many just traditional physical therapists come in and they give me my bed exercises, and then the insurance doesn't pay, and they're here 3 visits, and I've had this so many times over the last year and a half. And so I'm like, okay, well, she tells me that right off the bat, and I'm like, okay, well, we're going to do something a little differently here. And again, with her, her insurance it was very, very picky. It's a Medicare Advantage plan. And I knew I had limited time to work with her. So right off the bat, again, that's where, we're going to get on the soapbox of documentation for skilled services. Like I could go in so many directions, but I made sure that I connected the dots on why I needed to have that. And with her, instead of getting 2 visits, I was able to have 2 months of care with her. And in that 2 months, I established her own home health routine. She does her own routine. She's got her exercises. She knows how to progress them. The family knows how to help her. The family knows how to supervise her and assist her, so that even when I'm done, she's got the tools that she needs. Now, that's a situation where I'm coming in under insurance coverage. Right. Now, and again, I mean, some people, they don't have the means. Like I said, a lot of this stuff is going to be out of pocket private pay when you're dealing with somebody that wants to come in after the fact, or they're like, hey, I'm given up because the insurance won't pay for me to have any more therapy. And I'm trying to instill the belief that there are options out there. The resources might not be there for everybody to have me come in. However, when we look at patients that, younger patients that have health savings accounts, or families that have the means to be able to do that, when you're increasing a quality of life and you're increasing longevity and mobility and community access, I mean, it's insurance companies will need to realize that, hey, that's worth every penny, right, versus them falling and just continuing to be a frequent flyer into the hospital care system.
Absolutely.
Right? Yeah.
Absolutely. Well, I think you set up a perfect segue here for Lori. So, Lori, I'm going to turn it over to you.
Oh my gosh, I've been biting at the bit the whole time. It's like, because I'm back in the whole caregiver piece, and I can honestly say, and I've only been doing it since December now for two people, and that are family members, but I'm burnt out. I am totally fried, and I'm not burnt out with so much giving them care. I am just so frustrated with our medical system that pulls and drains so much energy and time from me because they are so inefficient on so many levels. And I know there's a lot of good doctors and medical professionals, but there are a lot of crappy ones as far as I'm concerned that take into consideration the person as a total being. We have gotten so task oriented and so finite in terms of what they think their job is and what people need. They're clueless. They're clueless. And you talked about, fall prevention and stuff. And I actually said to a doctor, I said, I don't know how many more people I have to talk to in this hospital. I don't know how many different ways I can say the same thing. But why is it not being communicated and everyone says it is? I mean, just a simple thing to talk to the doctor to get an update or to share what it's really like at home. And I'll just give an example here. Thanks for letting me vent.
Oh gosh, no, go ahead. I love hearing it. Honestly.
But I know so many people.
My wheels turn
through stuff like this. Like, the man was on oxygen at home as needed, rarely used it since, let's say, December. We're in July, and then had some breathing problems the last 2 weeks, trying to get a hold of the two services he's using, his provider and his specialty, which of course don't communicate, though everyone says they do, and everything's shareable electronically. There's just, it's no one takes the time to go to the special portal to really get the information. And then you're forced to be the specialist. So I pat myself on the back. I know a lot more than the average bear out there. And so I don't know if it's that I'm not oblivious to how things should work and how things used to work compared to how they are now that gets me so angry. Maybe other people wouldn't get so frustrated with it, but it's just not acceptable. And so here he's got oxygen at home. He's a super fall risk. And they're going to send him home, adjusting him now to 24/7 oxygen. And they're like, well, he can have a 25-foot cord, tubing and I'm like, no, he's got a bad leg. His gait's horrible. I can go on and on and on. He's having difficulty.
Do you have therapy in?
Oh, well, we finally got out of the hospital on Monday. We got the assessment today. So I'm sure next week we're going to have PT, OT, somebody to come in with showering. And then I said, I definitely want a social worker to coordinate some other things. And then of course the nurse. But again, those are short little visits. But what I really liked about the home health care agency that we chose, because we've had other ones before, super kind, super personable. Just like I want to work with this person, where in other cases we've had it where it's like click, 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 click. They're just filling out their forms. They need to run to the next person. And people feel that. Like you said, do I want to work with this person, or am I just another task? Is it just that they're going to point out everything that I can't do and not celebrate who I am as a person? I mean, those things are massively huge, but, getting that line of communication open with people, like I said, with this one, it took us, he ended up staying in the hospital extra days because I could not get that communication through. And it was, he thought he was going home, and then, things got screwed up again. And I'm like, no, we're not accepting him until this happens, where a lot of people probably would have taken them home. And he was a handful even once we got what we needed. And I'm, my guess is he would have been right back in the hospital probably the same day of discharge.
Exactly.
Without that. And I don't understand that, because I know CMS is screaming about fall prevention and rehospitalization. I really struggle with, how is that not worked into the situation? We've got another person home with him with cognitive decline. how do you not
Double
understand
whammy.
that they can't take care of these things? Or a person who's going home alone, who doesn't have those things and is going to have to rely on home health care and people like yourself, which it doesn't, I mean, they're not out there the same day, but the doctor's like, well, this is just our process. And sometimes you're a week, one time we were, I think, 3 weeks, a month out before that even clicked into gear because of what you guys were talking about earlier with not having staffing. And I mean, we even switched companies, same thing. They didn't have the staffing. So those things just drain me more than the care. It's the follow-up calls, the notes in the portal, the hello,
And that, yeah. Oh my gosh.
you ask a question, and maybe it's more than one, and they'll answer one of the three, and then you have to go back again. Those are the things for me in this round of caregiving that are so frustrating and so draining, and I just feel like a dog chasing my tail. And I've gone up and I've approached, and I'm like, there needs to be training, there needs to be consistency. You've got bodies working here, but they are not, I mean, and they're not functioning on all gears. And again, they're short staffed, so I'm sure they're all burnt out too. But
Yeah.
it's a scary, scary reality that we're living within. And so I think having someone to coach you and make you feel like you are a whole person and you are valued, and it's not just the task at hand. You understand the motivation behind it.
And just having somebody to hold your hand too. I mean, there's a lot to unpack on what you just said. I mean, it goes back to, again, you have many caregivers, nurses, therapists, social workers that just exited the profession after COVID, like literally didn't want to come back in. So we're still seeing the effects of that. And then if I can be honest, and, like I said, there's one thing I am is brutally honest, but having been on the side of being a Medicare licensed agency and having to be compliant with all of those things. And there's a lot of lip service that goes on, as we know, with the government, with Medicare and what they say and what they actually do. And there's things that have been put in place to try to eliminate exactly what you're experiencing. They don't, if somebody goes back into the hospital within 30 days after discharge, I mean, we're trying to eliminate these in and outs where they're not looking at the need of the patient and where the setting's going to be, and like kind of doing the homework. That's a social worker's position at a hospital, is to kind of make sure they are navigating and recommending the appropriate resources and getting them set up. Well, when you're going in and out like that, Medicare's like, okay, if, you go back in, I don't care if skilled home health is in, if you go back into the hospital in 30 days, you're getting dinged financially. And guess what? So is the home health agency. So things like that in place. But then what happens is that they still discharge them too early, and they end up back in, and then everybody's mad, and there's just no follow through. And people like you and me, and Lance, like, when we have the expertise to advocate, and we know how to advocate, but so many people don't. So many people are so lost in the process that they give up because they just don't know where to turn. And I think that's where, people like me and some other people that are doing like kind of consulting, like let people that guide you through this process, because it's so overwhelming. You don't even know. I mean, and I've been doing this for 27 years. In this space, I'm still astounded by the amount or the lack of awareness of what's available and what they can get and what they can do. And that's one thing. But then again, advocating for these things to happen, you know exactly how to do it. I'm a clinician, so I know I'm going to advocate for my parents. But there's so many families that really are like, really? I had no idea. I didn't know that I could get that, or I didn't know that that's what that was, because nobody's telling them. It's just they keep kicking the can.
Yep.
Right. So, one of the things that I do, even if I'm just seeing somebody for physical therapies, I'm teaching those power, the power of attorney that's in the case. Maybe it's a daughter, teach them how to advocate, what questions to ask, who to call, doing those resources, and it's exhausting. And when you're in a situation like you are, most people would have already given up by now.
Mm-hmm.
They're going to take what they can get, and they're just going to accept that dad's just not, okay, this is what we got to deal with. And people might not have the financial resources to do anything different.
Mm-hmm.
And there's nobody telling them that there's anything else out there, right? So it's just a sad thing. And, you brought up the fall risk thing too. And Medicare says that all they want, and they're absolutely not making it a priority. I mean, I know what you think, Lance, too. I love to have the annual Medicare wellness checks where they get their fall risk assessment. But then what happens?
Right.
Then what happens? Right. So it's super, super frustrating. Again, once I exited the corporate space, there was a huge relief for me, to be honest, because, your hands are tied behind your back half the time when you're trying to advocate for your clients and teach everybody involved how things should go. And sometimes you're successful and sometimes you're not. And that is really, really frustrating.
Yeah. Well, even just knowing, I remember years ago, I ended up calling in a patient advocate on behalf of my dad because the doctor was not listening at all. And my dad was literally like dying in the hospital. And he went from alert and watching a basketball game to going totally gaunt and incoherent in 20 minutes. And I'm like screaming something's wrong. Oh, no, that's just your dad. You don't know my dad. My dad's been here a day. Apparently you weren't in his room earlier when he was totally conscious and engaging and watching a basketball game. I said, I want a patient advocate. And they got a patient advocate and they rushed up another doctor. And here the primary doctor, physician on his case, withdrew him cold turkey from medication for swelling in the brain. And he said his brain literally would have almost like exploded from that swelling, and it was happening. He gave him a shot, and within 10 minutes he was like fine.
Wow.
I mean, it was like incredible. But if you don't know those things are there, and I was up kind of against a nurse ratchet, and I'm like, don't go there with me. You better get me
pick the wrong person
right now. And I don't like being like that, but I feel like they turn me into this mean person because they don't listen, or they won't follow through, or they won't guide. And until you really get angry and really stern.
I got put on a blacklist 6 years ago with my mom when she had her stem cell transplant at the cancer center. And then she was in and out of the hospital, and she ended up in the local hospital and her pulmonologist was her local pulmonologist. And he does not have a good reputation, but she was on a ventilator. And it got to where, my dad, who's also hard of hearing, is never asking questions. He just, if I say, well, what did the doctor say? I don't know, nothing much. I'm like, so I was there a lot. So I started being more involved. She was on a vent. They kept telling us that she was coming off the next day. And then we get there and she wasn't getting any explanations as to why. So I stepped in with this pulmonologist, came in, and I'll never forget it. My dad is sitting there and he comes in and, introduced myself. And he gives the update that she's not ready yet. She's gonna, we'll look at her later tonight and maybe tomorrow. And I'm like, do you mind? She's in the ICU. You have anxious family here. Can you? My dad wasn't able to tell me, like, is there a reason? Like, what's going on with her that you don't feel she's ready to come off of the vent? And he goes, well, I don't think I really need to get into a detailed explanation about it, but I just don't think it literally, and I just looked at him and he kept going on in this manner. And I'm looking at my dad. I'm thinking, okay, I'm really not wanting to be in trouble. I'm not wanting to be that person today. And I stopped him. I said, Dr. So-and-so, with all due respect, I said, I'm in the medical field, and maybe I can handle what you're saying, but you got people in the ICU, you got families who are already in trauma. They're scared, they're anxious. And with all due respect, your bedside manner sucks. And I said that to him, and he literally, well, I have never been talked to that way in the 40 years I've been practicing. I said, well, maybe somebody should have done it before now. And he walked out of there. And it turns out, we found out through all the nurses are like, he asked if I'm there, he won't come in. So he wouldn't come into the room if I was there. And that happened for like another 2 or 3 days before she finally came off the vet. And let me tell you, this is something hilarious. So, and I never saw him after that because he refused to come talk to me. She comes off the vet, my mom, who is a Christian woman, and my dad's on one side and I'm on the other side. You know, we're just in that waiting period, right? You're just kind of going, holding your breath, looking at the monitor, just hoping that she's going to be able to stay off of it, right? So we're holding her hand on each side, and my mom comes out. You know, she's kind of starting to get awake, and you know, she's, you get that raspy voice. You're kind of like, no, don't try to talk, mom. Hi, how you doing? You know, and she looks up at both of us. I am not kidding, and she goes, "Pompous hole." I'm not kidding. I about peed my pants, and my dad and I just were like, I go, did she just say what I thought? And I will never forget that. And I'm like, and I told my dad, I said, Dad, I apologize, but I'm going to always advocate for what I think is right. Yeah. And so she's like, he's probably going to try to kill me now. I'm like, oh my. So anyway, that was a funny story, but it just illustrates the need that, some people they don't want to take the time, and their bedside manner is horrible, and you will come across people like that. And I have the, guts to stand up to them, but most people aren't going to do that. And that's sad. Yeah. It really is sad. So, you're dealt with a multitude of stressors, right? And I think you're right. I mean, you it's not the hours that you're spending taking care of them, because that, it's appreciated and they need it. You're losing yourself. You're losing your sense of identity. Your health is in decline. You're not sleeping. You're probably not eating right. All of those things that people get into that rut. And I feel that, with the people I work with, being able to take them from a place of despair and sadness to instilling joy and motivation and empowerment is really pretty magical, because that is a domino effect. Yep. That person's going to put that out into the world. I'm going to put that out into the world. And it's those types of things that I think are so needed in healthcare right now, to where helping a caregiver like yourself kind of get your groove back, right? And that's why, Rockstar, people's like, why'd you name it Rockstar Health? I'm like, no, it's not Rockstar as in I want to be a rock star physically. It's an adjective. It's a feeling. It's like, hey, I can do this, man. I rocked that today. I did a good job today. I handled all the things I had to do, and I still feel pretty good. Like, that's really the concept and the feeling that I think that I want to instill in people. Because guess what? If you start feeling great, that's going to translate into the care that you're giving to somebody else, because it is a domino effect on a positive side or a negative side.
Yeah. Well, and they see the hours and the time and the frustration. And sometimes you're having those conversations by phone that they're overhearing, trying to get to the truth, and to see you getting cut off the line, and the transfer didn't go, or they transferred you to the wrong person, or the wrong department. I mean, all of those things. And then they feel guilty, and they feel they're a burden. And that's the last thing that you want. And why mental health is not taken into this equation, because when we feel better, we do better. I
think the statistics are 30 to 40% of caregivers report having signs of depression.
Mm-hmm. Yeah. And like you said, in that the person you're caring for is probably depressed because they need the care in the first place, and then
Yep.
we're just increasing that, which then everybody
Yep.
feels worse in the game, and it's just such a cycle. And I have to kind of laugh at myself because I know you had mentioned earlier about social connections, and I've kind of cut myself off again because I don't have the time, but it's like I have to get back into that and force that time no matter what, because then I'm a better person doing
Right.
that.
We
But
can't take care of others if you don't take care of yourself, right?
but it's, especially if someone's coming off a hospitalization, there's so many things to do. It's hard to fit all of that stuff in. Now, you had mentioned some stats. Do you have specific stats that you'd like to share in other areas of care that you're seeing that you feel are important, that just kind of caught your eye at all?
Well, and we were talking a minute ago, strictly about fall prevention, and I'm a fall prevention specialist, and I'm published in the area of fall prevention with cognitive impairment. So it's kind of a, near and dear to my heart. And I've been doing that. I think we're year 15 since my doctorate thesis on that, where I was published in that. And it really came about from the work I was doing at present, which was in senior communities. And, the stats are pretty staggering still. And that is that I feel that there's kind of a gap between, when I started working in home health and started the company over 20 years ago, assisted living communities was a whole different demographic. So now what you have is a situation where there's almost like a competition. Especially since COVID, people really want to keep people want to be at home. People do better at home. They tend to recover better, more quickly at home, right? However, that's not always possible. You want to advocate for, they always want to do that, keep them there as long as possible. When there's a safety issue though, or something comes in, what happens? Well, mom, we need to put her in assisted living. Well, we're at over 70% now of assisted living residents have some form of diagnosed cognitive impairment. It might be mild cognitive impairment all the way up through different stages of Alzheimer's, but that's not unexpected. I mean, one of the reasons, one of the two reasons primarily when people move into senior communities, or daughter moves mom in there, maybe reluctantly, is one, it's either a medication, they're having trouble taking their meds on time, or there's some type of medication compliance issue, or there's a cognitive impairment issue to where they just need more help. They want more supervision. And so they feel like that's the resort. And so now you have a much higher acuity level in those communities to where they are actually kind of competing with the skilled nursing facilities, because now they feel like, well, we have home health, we have nursing and therapy that can come in. You can come here, in a private pay situation. I mean, you don't need to be in that nursing home. This can be much more homey here, right? So you take that situation, and what we're finding is that 20 to 30% of the falls that are happening in these communities are very much preventable. Very much preventable. And that was kind of my wheelhouse for a very long time, which is why I did the research and the report that I did. And I find that there's still a lack of knowledge of how that works. And there's lots of physical things. Yeah, home health is now being extremely devised, sometimes, and to the point of trying to substitute for hiring staff, and I look at it and I'm like, you know what? Yeah, do I think I'm a pretty damn good therapist? I do. I've been doing this a long time and I'm a specialist in that area. But I'm only there a few hours a week. The program that I've developed in senior care communities, and when I do consultations, I did that when I had the agency, but now I do it from a consulting standpoint, where I'll come in for 2 to 3 sessions where I'm like, no, I want to create a vested culture in your community for fall prevention. Yes, you can utilize home health. You can bring in physical therapy to do balance training, all of those things, but you need a holistic approach. And, looking at how many of these falls are preventable, of how, you are going to have to include, I include everybody in these communities. I come in, I observe first. I'll come in for the day and observe, see kind of what's going on, kind of see the tone of the community. And then I'm looking at dining room staff and housekeeping and the aides and, you know, the guy that drives the bus to the lunch bunches. Like all of those people have, you know, they're the eyes of those communities, not just your director of nursing, not just the LPNs that are, you know, making sure the medications are getting there on time. You have got to look at a more holistic approach. So I really we prided ourselves on creating that environment for communities that we were taking care of residents in. And when you have that holistic approach where you are looking at not only the structure of the setting, right? I'm bringing in every month. And guess what? Nope, I want a representative from the dining room. Why? Because you're seeing these people getting out of chairs. You're seeing how they're acting. I want the housekeepers. My God, what a wealth of information they are. To where you create now the people that typically have the highest turnover. Those are the staff members that typically have had the highest turnover. They're in and out. They can't keep them. They can't find them. They are lowest paid. But when you create a situation where now they have a valid input, they're brought into meetings, you value what they have to say. All the research shows that it doesn't matter what industry you're in. When you do that, when you include them into care conference meetings and my fall meeting every month, magic happens because now they feel comfortable and they feel that they can approach the nursing director or me if I'm running through the building and say, hey, Mrs. Smith, this morning, she was in the bathroom when I was in there getting taking the trash, and she seemed really unsteady. I've never noticed her being unsteady before, but something seems a little off with her today. She was the first person that saw that. She came in and, you know, like kind of like to see something, say something, but normally they wouldn't feel comfortable doing that. Yeah. But I want to hear those things because guess what? Now we're going to get on that. We're going to go in and find out. I'm going to send nurse maybe go in and take some vital signs. Let's see what's going on with her. You've now initiated kind of a roadmap or initiated a plan that definitely probably prevented a fall from happening.
You've developed a team.
Yes, so you've got to,
you know, our companies don't have a team. Yeah. We've micromanaged them into departments.
Task, right? Yeah. You're exactly right. And so it didn't matter if it's like a skilled nursing facility or an assisted living or even an independent community where people tend to be more, I'm more worried about a lot of the people in the independent communities than the assisted living, believe it or not, because some of them have no business being out there. But it doesn't matter what that setting is, there's room to create that vested culture. Because what happens when you create that vested culture, guess what? Gosh, your employee retention rate goes up too, because now they have higher job satisfaction. Mm-hmm. Right? They feel like they're a member of the team. They have a vested interest in the safety mm-hmm. of those around them. And you can take that roadmap and take it into a hospital setting as well, where you're looking at each of the teams, right? The aides and the therapist and people that are running around checking the boxes, right? It's just a matter of finding a way to have people stop and look up. Like I said, you know, there's a reason why I named, you know, what I do now and the keynote speeches I get and this coaching program, it's Look Up and Change Your Life. It takes on so many meanings. So many meanings.
Yeah, that's great. Lance, do you have anything to add? Because I mean, you're one of those companies with a home health company with training and approach of, you know, that holistic, that whole person.
Yeah, well, one of the things I would add, and I'm sure, Shawn, you do this as well, but, you know, when we take on a new family, and even if they're not going to hire us or use our services, they'll call for a home safety evaluation. And we're always happy to do that for them. And, you know, we go inch by inch, room by room, exterior and interior, floor by floor of their home, because we're trying to identify fall hazards and fall risks for, you know, their loved ones. And I would say 9 out of every 10 that we do, we find a multitude of, these hazards that we just take for granted, and the average person, I don't fault them, don't even think about it. Something
They
is
don't.
something as simple as having slip resistant rugs in the bathroom, or taking cords out of walkways, or adding grab bars into the shower, or a shower bench, or a shower chair, things that are very easy, minimal cost to fix and just help to reduce those risk of falls.
That's exactly right. And teaching other people too, because it's, when you teach about looking at those home assessments, I always break it down when I used to teach continuing ed courses across the country. I just break it down. It's so easy when you look at and you divide it up into extrinsic factors and intrinsic factors. And there's a list for each of those. And it makes it so simple to go through that. And like you said, pick out the things that normal family members are just not going to look at and making those suggestions. So yeah, looking at it from a comprehensive approach with your intrinsic and extrinsic factors, your extrinsic being your environmental factors, like you said, whether it's something entering the home, rugs, grandma likes the rug that matches the shower curtain, that matches the towels, and she doesn't want to move it, right? Of looking at something like that or finding a compromise. You're exactly right. And those home assessments are critical. And a lot of times, we should be doing them every single time, like with every single new client. That should be
Yeah.
mandated.
Well, and I know for us, we don't even have a cost associated with it, because that for
Right,
us is it's a
exactly.
safety thing. So we do quite a few of those. But, for people watching or listening, I highly recommend it, because, like I think you gave an example of somebody who had, you walked into this woman's home and you could tell there was more than just, home health going on there, but the family probably didn't recognize that. And sometimes families, they live long distances away, so it might just be at the holiday time that they even come to their parents' home or what have you. So it's always a good idea, get a safety evaluation, just kind of get an idea what's going on in the home, and it might reduce and take away that risk for a significant fall down the road.
Yeah.
And really get as much information as possible. Or like you said, when somebody's discharging from the hospital and coming home, has anybody, have they asked the right questions? Like, have they asked what's the environment like? Where are they going? What's the structure of the house? Things like, are there steps? Like, it gets lost in translation from the acute care setting to the home setting, to where they end up coming home without the equipment that they need. And again, fall risk is through the roof.
One thing I would add to that, we've had so many families who they've been discharged to home, but like you said, asking the right questions. They're discharging somebody that just had a total hip replacement. They didn't ask, do you have a bathroom on the main floor? And so now this person is going home. They have no way of getting upstairs to their bathroom, or vice versa. Their bedroom is upstairs. They don't have any sleeping arrangements in the, main floor of the home. So all these things, just properly setting them up for a discharge to, safely go home, is so crucial, but it seems so difficult, right? It's so simple too.
Mm-hmm.
Yeah.
And it goes into, like I said, assisted livings as well. When somebody is moving in there, and it's about this, let's get them moved in. We did, those are like no cost, exactly. Like, no, let me take a look at this room, let me make sure, okay, well, the last available room you have is at the end of the hallway, and this person has significant cognitive impairment and they walk with a walker, but they're stuck down at the end of the hallway. But I need to look at this room. We're going to do this on every move in. I want to check the room.
And is the person even a good candidate for assisted living to begin with?
Yeah, there you go.
I can't.
Imagine that.
I'm sure you've experienced this.
That's our number one question.
Yes.
Is, again,
Yeah.
Is the setting appropriate? Is the setting appropriate? Can they provide the care that, because, let's be honest, the marketer is going to have a viewpoint, an incentive a little bit differently than when actually somebody gets in there and says, wait a minute.
Yeah.
What do you mean they need two persons and a Hoyer lift, which
Yeah.
you see now all the time in assisted living, which you never used to.
Exactly.
It's a two-person assist. I'm like, you got to be kidding me.
Right.
But a lot of that, I think, has disappeared because everything's bottom line. And your marketers are the ones that turn over, I think, the most, because they get blamed for everything.
everything.
If they have a conscience and say, no, we're not going to be a good fit for you, or we don't have an opening right now, they've just lost a number. And and I'm not going to say all companies, but in a lot, that jeopardizes their job. Or when you guys were talking about grab bars and stuff, it's so funny because I think people think grab bars can only be in the bathroom.
Right.
But when I did an interview with a gal who sells grab bars, and she said, I had my hip replaced, and she said, we've got 2 steps from the garage into the house. She said, man, we put a grab bar there. She's like, I'm getting older, and so is my husband, but that helped me for that. Just that little thing, because she was well aware of falls and things like that, or going down steps or going up steps. You might not want to use your regular railing because it might not be able to hold your weight if you lose balance, and then you and the railing are both tumbling down the floor.
Right.
So yeah, there's so many different aspects. So don't think any question is a silly question. If you're concerned, mention it. And you will find out really fast people that you're working with, like even with this last hospitalization, 99% of the staff were very nice and kind, but there still wasn't the follow-up, and so people can be nice and kind and not necessarily still follow up, but that shouldn't be acceptable. Anyways.
Yeah. Some people have the best of intentions.
Yeah.
And they, whether it's, a productivity thing or something that they like, they meant to do something, they just didn't do it. And I'm sure it goes, I'm looking at both sides of the coin, but it's nonetheless, falls are of epidemic proportions in this country, and something has to be done. Something has to be done about it. And I think that was, something I became very passionate about 15 plus years ago, and making sure that, now that I do a lot of just community patients, again, like you said, Lance, people just, something that I would pick up on right away as soon as I walked into a home. And sometimes you can make an adjustment that particular day, and you just reduce somebody's fall risk by like 50%. That the families didn't think about. They're already overwhelmed.
Absolutely.
They already have a million things on their plate. So that's where, we come in when it comes to that. But, having a holistic, proactive approach to fall prevention, no matter what the setting, is critical, right? Because it's not, somebody has a total hip replacement, and of course I'm coming out to do protocol work, the surgeon wants this, and this. Not all that's not what it's all about. Right. I have a patient right now that is in that situation where he ended up with a hip replacement. He's a farmer. He's 75. He still wants to tend to his steer and get on his tractor. And he had an avulsion fracture first day of outpatient therapy. On day 2 post-op, he goes there and ended up with an avulsion fracture. And don't want to get into that story, but refused this. So I've been in with him for quite a bit. He's doing great, but what he wants to get back to, that's totally different, than most people. I need to go walk out down my 3 steps onto my gravel driveway out to the barn on uneven surfaces and get on my tractor. In fact, we're about finished with him now. We walked out to the barn the other day on the gravel in 85-degree heat, right? And he gets short of breath. And because I was trying to drive a point home to him because he wants to get on his tractor. And once I saw the tractor, this is not any ordinary tractor. Mm-hmm. This is a pretty large John Deere where the seat was above where my head is. So I'm going through A, B, and C with him. And I'm thinking, I don't even know if I could get on this tractor, right? So I'm going through those faults. I'm like, listen, here's why you're healed. Yes, but here's why. And I have his wife is there with me. I'm like, okay, listen, unless you want to take this risk, right? And so it turns out, what he did after I left? Got up on the tractor. Oh. Found out the next day his wife tattled on him. He's like, well, I did fine. I'm like, yeah. So there's some things you can control and some things you can't from a compliance standpoint. But, the tangent I went on was just individualizing the approach based on what that patient needs. to get back to? What's their prior level of function? You've got to look at that.
Well, and I think, in that example, it was quality of life. To him, that was really.
Yes, and I want that for him so badly.
And so there are risks involved, and sometimes you got to let go and just say, this is how he's choosing to live his life. You've shared the lies and the impact, and that's all you can do. Now, if he was in cognitive decline and couldn't make
different story.
Yep. So there's just so many things. The other thing that I think would be interesting, and maybe you offer this, is when people get discharged. I'm a forms girl. So I have a blood pressure chart and weight charts and liquids, all of those types of things. And now I do everything on my phone. We just go through everything and I log it. But I can, daily there's certain things we do, oxygen and stuff like that. But having a form set up, or maybe it's just taking the pills, having a med sheet that makes sense, that they don't maybe know how to do a form, but they could write it in, or they could type, download it and type it in, depending on where they're at. Just knowing that, hey, this is really common. This is what professionals do. We're logging, but we're transferring that here, and we're telling them that this is important, but we're missing those tools to give them, to help them. Sometimes it's just remember or refer back. Gosh, how many, you're only supposed to have, 1,800, milliliters, how much have you drank today? And I mean, most of us don't remember what we had for breakfast or lunch, let alone how many times we drank or voided or whatever it might be. And they're common questions. And if you just have that little cheat sheet there, I think a caregiver's life's easier, even though it sounds daunting. You have a backup. I think it's easier, and maybe it's just my personality type, but I think it's easier to sleep when you know you have the answers.
I'm anally organized, like to a recovering type A, I call myself, but to a fault. But it certainly serves me well in these types of situations, because even if I'm working with somebody, like if I'm even consulting virtually with somebody who maybe doesn't have the services or not able to get the services coming into the home, I will send PDFs through email that they can have or print off, that they can print off, whether it's, again, looking at fall risk, intrinsic, extrinsic factors, things to keep track of oxygen saturation rates, things to track. I'll give somebody a 3-day food journal to look at their food nutrition. I want you to write down absolutely everything you eat, and then we're going to talk about the next time. Like those types of things are very easy to incorporate, even if somebody doesn't have like a skilled service coming out into the home. If you're doing it from a consultation basis, I love throwing those in. I try to give as much objective information as possible, because that's only going to help me as I work through sessions with people. Is if I give you something objective to keep track of, it's going to give me a wealth of information that I can then in turn, use for a plan, right? A treatment plan.
Exactly.
Yeah, that's a good point.
Well, I know that we need to kind of wrap up it. Everyone, I think, understands the value that you bring as a speaker and a health strategist, as a PT, as a coach. So I would encourage people to definitely reach out to you and see what all you have to offer. We only have a few minutes left. Briefly, is there anything that we haven't covered that you just really think we need to let our audience know? I mean, we could do a week's conference on, the holistic piece. And
I think, what it comes down to is that I try to instill in the older adult patients that I take care of, is that it's never too late to learn new skills. It's never too late to make healthy changes to improve your health, your safety, your quality of life, both physically and emotionally. It's never too late to look up and do that. And that includes, like I said, an 85-year-old patient who maybe feels like there's nothing left for them, or the daughter that's taking care of them. It's never too late to make those changes. And that's one of the reasons why I developed, Rockstar Health and Rockstar Senior, just really to bridge that gap. And I have, if you look at rockstarhealth.net, you're going to have all kinds of resources. I try to throw videos on there. Rockstarseniors.net, you're going to have dozens and dozens of educational videos on there that you can find for at no charge. And then, primarily my work now is doing consultations and personal coaching. And it's very individualized. And it just starts with a health strategy call. I do those for free. I get on the phone with you. I want to hear your story and I want to see what you're struggling with. And that's the best way to know where to start, whether it's something I need to integrate fall measures in, or more of how to prevent caregiver burnout, or how to navigate the stages of different types of dementia and prepare for that for your loved one. I love the diversity and the variety that I get doing this work. So again, it all funnels back to getting on a call with me, and make sure your listeners have that link that they could just get on there and schedule it directly, so that I can talk with you and hear your story.
Okay. And again, your website is rockstarseniorsPlural.net. You also have Rockstar Healthcare or Health. I'm sorry, Rockstar Health.
.net.
And
yeah.
And then you are Instagram, Facebook, for not only Rockstar Health Group, but on Facebook, you are Dr. Shawn W. as well. And then you're on LinkedIn and YouTube, and the YouTube channel is Regain Your Rockstar.
You got it.
And then to email you, they can, I would imagine, go through your websites, probably the easiest.
Yeah, there's a direct way to get a hold of me through the website. If you go to rockstarhealth.net, there's even a link to Rockstar Seniors. That's kind of the primary site where you can navigate the programs and directly link to get on a call there also. So that's probably might be the best place to start, is the rockstarhealth.net website. Yeah, because you can find it all there. And ShawnWeiss18@gmail.com. You can reach out if you have any questions for me as well.
Perfect. Well, thank you. Lance, anything you want to add in wrapping up?
No, it was a great discussion, Shawn. Thank you so much for the work you're doing and the advocacy. I just want to put you on the spot. Give our viewers and listeners your number one tip for family caregivers before we go.
Number one tip for family caregivers, I think, is being present. Finding a way to be present, and that goes back up to the lookup theory, is stop what you're doing and take it in. Know that your emotions and your attitude are going to affect not only yourself, but the people that you're working with. But to be present and be grateful and positive, that starts the whole process.
Wonderful. Well, Dr. Shawn Weiss, thank you. Lori, always great to see you. Until next time, join us here at Conscious Caregiving with L&L.
Thank you guys so much.
Thank you.
Thank you for joining us again here at Conscious Caregiving, where we're tackling tough conversations. We look forward to seeing you again here next month.